Okay, my name is David Scott. I'm from Swan Lake Reserve. I am elder here as well as an advisor on policy. And I'm in the community health center right now.
And so why are you wearing the mask right now?
I'm wearing the mask right now because I left my house and I'm in this public building. And for my own protection, I wear a mask so I don't catch anything, whether it's the common cold or the flu, because of my weakened immune system. And the community nurses here do everything they can to protect me.
And what are some of the impacts of COVID as they're affecting your community?
Mostly it's the ability for us to move about. There are some stresses that we're trying to deal with right now, whether it's mental health or whether it's controlling the activities of our people, going in and out of the communities, those kinds of things. And there are still some problems with some people that are not following the suggestions of separating from one another. People that live in poverty don't always make the good decisions that anybody else that is not living in poverty makes.
So those people that want to come back, they're being turned away. Is that correct?
We're not really turning them away. We're asking them to self-isolate again, but again, they don't have a house over here that they can self-isolate in. It's usually with other family members that they move into, which presents us a danger to the members that are here. And then there's a lot of questions. In the springtime is usually when we have ceremonies regarding fixing graves, that kind of thing. And then there's places, those things that we normally do that we congregate in, particularly around the spring ceremonies that are going to be coming up usually in May. Yeah, we do have a lot of concerns around those kinds of things. So the anxiety is, how long is this going to last?
So I think you mentioned when we were chatting last that the Sundance actually got canceled.
People come from all over the United States and Canada to have these ceremonies. So we're not having that at all this year. It affects their spirituality and their understanding of our traditions and what we must do. This is new to us. This particular virus is new to us. And all I've been doing is advising people about waiting for warmer days so we can participate outside and still have that separation that health is calling for, right? And then there's other people that want to have ceremonies just because of this virus and calling on their spirituality for protection. So I've been talking to people through my window at my house, and just telling them some of the things that they can consider, and that we can delay some of those ceremonies until a little bit further when the weather is warm, and then we can be outside.
Can you talk a little bit about some of the initiatives that the community has undertaken to take care of its members?
Well, for one thing, they identified all the vulnerable people, such as myself, because of my medical conditions. And then the other thing is they support us with food. They give us food so we don't have to worry about that. And that's the whole community. They give them their basics.
When you think about the support that they're being provided, even around information, how is there a bottleneck around information at all in terms of kind of health information?
Yeah, there's our communication strategy hasn't been good. There's communication coming out of the band office under the chief and council, and then there's communication coming out of the health center, which is different at times. They are certainly not qualified to be making these decisions when it comes to these health issues.
What would your community do if they have a case of someone that's positive? Is there a plan in place?
Can I interject?
Yeah, come on in. Hold on, the community nurse is right here.
Okay, great.
We do have a plan. We have a building on reserve that's used for Jordan's Principle on a regular basis. Currently, right now, it's empty. So Red Cross did deliver some supplies here, which included cots and hygiene packs, pillows, and blankets.
You see why we count on these ladies? They know it.
So generally, how do you feel pretty confident that the community is kind of got a good emergency plan moving forward from a medical perspective?
I do think so. Yep. The health team here is all on standby. Not all of us are in the office just to prevent any exposure to COVID-19, but we're all closely knitted. We've got all of the precautions in place if we do get a positive case out here.
When you compare, for example, what's taking place here with COVID-19 with H1N1, is the response equivalent?
H1N1 we didn't do very well, but compared to, say, the TB epidemic, the health services of the province at that time made all of those decisions, and we were not participants in that. Not even in that did we have a say in that. In the more recent modern day epidemics that have come through, or diseases, even the common cold, we have more control over what we can do. And it's us just getting properly organized, having the proper authorities to enforce some of these rules on our own people. That is maybe a little bit on the failing side in this community right now.
What kind of authority do they use? Are they going to arrest people? Are they going to evict people? What are they going to do?
Under the emergency, the emergency services in Manitoba, then that automatically falls on the responsibility of the chief and council to enforce those laws. And the chief and council should properly delegate that authority over to the health department, being that this is a health issue, it is not a political issue. For instance, if a band member is forced to quarantine and doesn't agree with it, and they run all over the place to get, say, the political people to make a decision about their quarantine. Those are the kinds of things that we're worried about. And that authority should properly be in the place of the health department, not the political department.
What have you heard regarding the Spanish flu? What did they do to deal with the Spanish flu when it occurred in Swan Lake?
One of the big things that during the Spanish flu was they confined Indians to within the boundaries of their reserve. We didn't always have the resources that we needed to survive those kinds of things. And you were forced by law not to leave the boundary of the reserve, right? And Section 30 of the Indian Act said that that's a trespass law. No white person can come onto the reserve. So that white people didn't know what was happening to us in the boundary of the reserve. It was only Indian Affairs that had that knowledge, that information. So that's the scary part of it, right? That was the big thing. And there was no medical attention being given in the reserve. You were the lowest of priorities in provincial health or federal health. Well, to get medicines that we would normally have accessible through here, you had to do it behind the Indian agent's back. And the punishment was severe. I don't think people today would tolerate that thing. They'd shoot the first guy that ever told them you can't do these kinds of things. They don't put up with that anymore.
Good, thank you. Thank you very much, Dave. That was so much good information. Yeah, I love your stories.
Yeah, I got a lot more. We can talk for years. Bye. Giwab min mina.
Kigob min mina.
Miigwech.
Kanawin, desan away,
Okay, miigwech.